So I'm Monique Rochelot. I'm the Associate Executive Director with the Réseau. And thank you everyone for joining us today. It's wonderful to see all the people joining us for the Winning Strategies webinar. I'm quite thrilled here. So before we get started, just a few housekeeping items, because there's quite a few of us on the webinar. We do ask that your mics are muted. Alors veuillez garder vos micros en sourdine, s'il te plaît. The webinar is being recorded, and the reason being is that we will be sharing this with you afterwards, and it would also be available on our website, along with the presentation, the slides of the presentation. We will be sharing the link afterwards. The presentation is in English. However, the slides are bilingual. Alors, les diapos sont bilingues pour les gens qui désirent suivre en français. What we will be doing is using the chat option for any questions you will have. I will be monitoring the chat and answering the questions as they come in. We will also be using this as a Q&A. So if there's anything that is pertinent, and we'll see that is being repeated often, we will be having a Q&A that you will have access to. And maybe, Fanny, we can move on to the next slide, because that's basically what our housekeeping issues are here. Thank you. So as you can see how the slides are organized, there's the French and the English version, so you can follow as your choice. Vous avez également l'option de poser vos questions en français si vous le désirez. Et comme indiqué dans la diapo, nous allons le répondre dans la langue choisie et offrir un court résumé en anglais s'il y a un besoin. Let's see here. I think that's it for our housekeeping items. I haven't forgotten anything. So before we move forward to the presentation, I'd just like to invite Fanny, who's the Community Engagement and Planning Officer for the Nipissing-Témiscamingue region, to offer the land acknowledgement, la reconnaissance d'état. À toi, Fanny.
So hi everyone. So for the land acknowledgements today, I apologize in advance if there's some words that I don't say properly throughout the presentation, as English is not my first language. So there's a few words that I might mispronounce. I apologize in advance for that. And there you go. So honoring our stories from yesterday, today, and tomorrow as allies from the First Nations, Métis and Inuit, we thank them for being the keepers of the land where we are privileged to live, work, and thrive. I'm currently on the Anishinaabe traditional territories, and I invite you to take the moment to recognize the land on which you find yourself today. As a Francophone organization, we are grateful for all the Francophone linguistic and cultural roots that enrich our identity. We are committed to creating quality spaces in French to foster the Francophonie in healthcare. We assume that all presents today share the value of inclusions. We humbly recognize that understanding the experience of others is an individual learning process. In this co-learning approach, we welcome everyone's uniqueness today to ask questions like Monique just previously mentioned. So here's our agenda for today. We will have
a minute, Fanny.
Oh, I apologize.
So merci, Fanny. Alors, nous allons, we will be moving on to item number 3. And I'd like to invite Sheena, because I can't see the participants on my screen for one reason or another. So hopefully, Sheena, you're there. Sheena,
I am. Bonjour. Yeah, I'm here.
Awesome. Thank you. So Sheena is the Director, Health Equity, French Language Services and Priority Populations with Ontario Health North. And they have been a great supporter of this initiative. So I invite Sheena to say a few words.
Merci Monique, and merci tout le monde. Hello, bonjour. As Monique said, my name is Shana Calix-Pitawanaquit, and I am the Director of Health Equity, Priority Populations, and French Language Services for Ontario Health North Regions. I'm here with my colleague, Sophie Lefrancois, who is a lead for French Language Services. And thank you very much for the opportunity for us to be here and to join you today and to provide some opening remarks. I'm delighted to help you open the session where you'll explore actions aimed at enhancing active offer and services for Francophone communities. Les stratégies gagnantes, or winning strategies, shared by the entity will provide insightful approaches that will elevate engagement and support for French-speaking clients in our region. So sessions like this to understand local differences to help transform, integrate, and support health service providers and partners who deliver healthcare to Ontarians across our large and diverse province are very, very important. Ontario Health has 6 regional teams that coordinate and direct healthcare planning, funding, and delivery, and drive improved performance, value, and experience, ensuring equitable access to high-quality healthcare. This includes ensuring that partners, such as yourselves, providers, and clinicians, have the tools and information they need to deliver quality care within their communities. Today's discussion is important as it underscores our collective commitment to inclusivity and improved service delivery. These actionable activities reflect our dedication to meeting the diverse needs of our communities, ensuring every individual receives exceptional care and attention. French language services are an essential part of healthcare planning and are central to the core work of Ontario Health, as evidenced in our annual business plan. In this respect, Ontario Health teams, or OHTs, and health service providers work diligently to ensure Francophone patients can fully participate in their care. Offering services in French goes beyond mere language accessibility. It facilitates comprehensive, equitable care by enhancing better communication, improving patient engagement, and addressing health disparities. For OHTs and service providers, integrating French language support enhances care coordination, boosts patient satisfaction, and reaffirms our commitment to serving all communities effectively and equitably. So I encourage you to actively engage in the session, post questions, and consider how the winning strategies can be effectively implemented to benefit our Francophone patients. Un gros merci, a big thank you to the Réseau for organizing this webinar, and thank you all for coming. We hope you enjoy this session. Merci.
Merci beaucoup, Shayna. Maintenant, je vais passer la parole à Diane Quintas, qui est notre directrice. She's the executive director with the Réseau du Musée francophone du Nord de l'Ontario. And Diane will give us a brief, some context about the Winning Strategy Initiative. À toi, Diane.
Merci, Monique. Bonjour tout le monde. Good afternoon. As Monique said, I'm Diane Quintas. I'm the Executive Director of the Réseau, and I'm so happy today to see so many of you here on this webinar to learn about the winning strategies and how best to serve our Francophone populations here in the North. At the end of March 2024, the Réseau launched the Winning Strategies Initiative in Northern Ontario, and we did this in collaboration with the Nipissing Wellness OHT, Équipe de Santé du Bien-être Nipissing. Since March, we have had the opportunity to provide an overview of the initiative to the majority of the OHTs in Northern Ontario. The goal of the initiative is really to help all health service providers improve the quality and access to French language services that they have. The initiative consists of 6 actions, and the actions are not new requirements. It's something that most of you are already doing as health service providers. You're already implementing and working on with the health planning agents across Northern Ontario. More importantly, this work provides each of us with the opportunity to measure our progress and to use the data collected in order to respond to the needs of French language services for the purposes of planning and reporting. We have received support from 5 OHTs in Northern Ontario, and I know most of you here are from those 5 OHTs, but also from Ontario Health North. Thank you, Shayna and Sophie, for being here on behalf of Ontario Health North. And we are really happy to have that support as we move this strategy forward in our region. We'd like to, however, give credit to the strategy to the Kids Comfort OHT, which is in Eastern Ontario, and of course our partner, the Réseau des Services de Santé en Français de l'Est de l'Ontario, who developed the initiative. To date, there are 14 OHTs in total across the Eastern and Northern entities that have committed to participating in this initiative. So thank you again for your ongoing interest, your commitment to improve access to French language services, and we look forward to the great work that we're all going to do together in Northern Ontario for our Francophone population.
Merci beaucoup, Diane. And now we'll get to the most interesting part of what this strategy is about. And I'll invite Fanny to lead you through this webinar. À toi, Fanny.
All right, so let's dive in. So why must we implement the winning strategies? The Francophones in linguistic minority situations face different language barriers that affect the quality of their care, which I'm sure of you have heard many different things throughout your work on the OHD or different committees. So there is the language mismatch, linguistic insecurity, and the obvious bilingualism. When a patient is sick, they are not bilingual, which I can very much relate to that phrase. So we have here a Francophone testimonial. So my mother tongue is French, but I consider myself to be perfectly bilingual. Even my knowledge of medical terms is better in English than in French. I always had English-speaking doctors until I was 27 years old. It was when I finally had a Francophone family doctor that I realized how cumbersome my English language medical appointments were. Even though I knew the specific terms better in English, when I needed to describe how I was feeling and my symptoms, I had much less difficulty discussing them freely with my French-speaking doctor. And it was as if for the first time, I really felt understood, and as if there was a familiarity thanks to our shared language. So the impacts of the language barrier, there is obviously equality and a safety of care. If the clients and the patients can understand what they are being told and what the medications, the labels, the documents they're signing, obviously there's a lot of things that can be involved in that. The compliance with ethical standards, effectiveness of care. Again, if patients and clients understand, they won't be coming back quite as often as they will be served correctly the first time. User satisfaction, access to health and information, confidentiality, and healthcare costs. Again, if patients and clients are constantly coming back into the system, that affects the cost. It affects a lot of different things throughout the system. So the winning strategies as a solution to improve French language health services. What are the winning strategies? So that's what we're going to talk a little bit more today. We're going to go a little bit more in detail. So there's 6 simple and effective and pragmatic actions to implement within all the organizations to promote the active offer of French language services. The objectives of those 6 actions is to promote an active offer or more effective and accessible French language health services for the Francophone, and develop the capacity to refer those clients to French language services when necessary if different HSP do not offer these services in French. So here's the official poster. So as you can see, it is also in bilingual. So we have an English side and we have the Francophone side. On the poster, we all love a one-pager sign to post in the agencies, I'm sure. So let's dive in a little bit more. So the action number 1 is to identify 1 or more champions, which I won't go too much in detail right now, as we will a little bit in a little bit of time. A couple slides later, we will dive in a little bit more. So I'm just going to move on to number 2 for now. Number 2, empower staff members. So the champions will be invited to follow a little intro on how to implement the winning strategies, and all staff members, including the new staffs, will do the online active offer training also, and the staff will be informed of all procedures in place to master the winning strategies. Number 3, identify staff members able to provide those services in French. So all staff will complete a self-assessment. There will be a little registry of staff members with French proficiency so that it is obvious for all people to know which people can offer those type of services and which one cannot. Team managers are aware of who can provide those services in French at each shifts. So it's just easier again for everyone. Staff with proficiency in French will wear a badge, Je parle français, and have also a bilingual electronic signature. Number 4, identify Francophone clients. So patients and clients will be greeted both in the official languages, hello, bonjour. They will be asked their mother tongue, French, English, or Italian, Spanish, etc. And if obviously it is not the official language of Canada, English or French, which language they are most comfortable being served in, French or English. This information will also be stored into the client's file. So it will follow the client so that, again, they can be served in the their preferred language throughout their care. Staff will be aware of which language the clients are most comfortable receiving their treatment before it begins. Number 5, match Francophone clients with staff members able to provide those services in French, or refer Francophone clients to another provider offering equivalent services or equal quality in French. So the Francophone clients will be matched with staff, again, who have proficiency in French. They will be paired with bilingual staff or unilingual English staff in similar positions to offer services to Francophone at all times. Developed or a referral agreement or services providers who offer similar services in French, and develop a process to make sure the clients aren't penalized in terms of quality and wait times. Number 6, measure the results. Incorporate a question of satisfaction with services received in French into the customer satisfaction survey. Measure the share key indicators on an annual basis, and annually identify and share with your OHD the services that you have available in French, obviously if it applies to your agency. So who can implement the winning strategies? All Ontario Health Team partners, regardless of whether or not they provide French language services and regardless of the clientele they serve. What makes the winning strategies easy to implement? It is free. It's personalized coaching to partners engage. It's tools to facilitate the implementation of all the winning strategies. And it's developing a community of practice, which again is a main focus on the OHDs. What the winning strategies do not do. The winning strategies are not intended to force the partners who have no obligations under the French Language Services Act to develop and offer French language health services. They are designed to facilitate the referral of Francophone clients from these providers to a partner who offers the same quality of services in French, like we've seen previously. So the benefits of adopting and implementing the winning strategies for partners organization, again, as we've seen, it is simple, effective actions to implement and improve the active offer, tools and free support, additional assistance to meet the designation's requirements, additional support to meet HSO standard, I apologize for that, on access to health and social services in the official language, strategies to promote safe, ethical, and equitable healthcare services for Francophone minority communities, and your opportunity to advance your equity, diversity, and inclusion in your equality. So the next steps, so here we're going to talk a little bit more about the first one, the first action. So identify one or more champions in your organization. So choose one or more champions for the organization. Confirm your commitment by emailing us using the letter or a template. It will be shared by you by email after the webinar. Provide a list of all staff members to register them for the active offer, which I know a lot of you have already signed up for the active offer or have already even completed the active offer online training. So we thank you in advance for that. We really appreciate it. And that's one step done for you guys. Inform your staff of the active offer training to be completed. Your champions will be invited again to attend a training session. For the champions in each organization that will be designated to have this position, they do not need to master French. It is a person that is going to have an influence or in a leadership position. That is someone who is convinced that the patient's safety mostly depends on the offer of health services in French, and is just really sensitive to the challenges of the minority communities, and acts as an agent of change within the organization to foster an organizational culture sensitive to the needs of linguistic, again, minority. So as I just said again, complete the active offer training, develop and implement a plan to further winning strategies inside the agency, act as a project contact within the organization so that people can refer to you if they have questions, communicate annually the implementation progress and key indicator with us, le réseau du mieux-être francophone du Nord de l'Ontario, ensure that the organization's annual action plan objectives are met, and participate in developing a community of practice. So we're already at question. I don't know if people have already inserted questions in the chat. I wasn't paying attention.
Fanny, before we go there, there's just a few things I think it's really important to note, because we went through that like really fast.
Sorry.
So maybe you can go back to the 6 actions.
Yes.
Start with number 1. Thank you. I just want to point out something really important. We call them champions, but it could be a resource person. It could be the person in your organization that's already working to complete the FLS report. So the word is champion, just because it will be the one responsible. You can call them a resource person. The champion is what we had here for the presentation, but it could very easily be just the resource person. You will also note that for each of the 6 actions, there are key indicators that are noted. So for action number 1 will be the number of champions in the organization, or the number of champions within each of the OHTs. So we will be looking at this information with each of the OHTs to ensure that, okay, how many HSPs have registered? We've already have a list at the ones that have completed. So we will start from there, and the number of champions that we are able to identify. And if I'm not mistaken, the resource officer, each of the regions, have probably approached the OHTs, or will be doing that shortly, to actually get a list. Who in your OHT will be our contact person? And do we have a list of, can we share a list of the member organizations so that we can just send an invite out? Here's what we're doing, here's where we're going, and this is what it's all about. The goal here is, if you can scroll to the next slide. So even for number 2, the indicator is the number of members that have completed the active offer training. That we will be able to offer you. We work in a group. You can work as a group to register as an organization. We do have the ability to be able to provide you with ongoing data in regards to where you're at, what's your progress, and how things are moving along with the employees in your organization. So we also do it at the HSP level, and at the OHT level. And we're not giving out names, it's just numbers here. And we will also be providing for each OHT, and we've done it, but in the past, not for certain OHTs, but will we also be able to already share with you the ones that have already completed within the OHT, so you're able to see who has the 100% of their personnel that have completed. And those people do receive a certificate in recognition of their work. So those key indicators, and if you want to move on to number 3, in terms of the staff members, it's the number of staff that have been identified. Number 4 is the number of clients that have been identified, number of who are seeking their services in French. 5, I just want to point out, we do speak here, and this is something that we do need to update on this slide, is we talk about referring Francophone clients to another provider. We recognize in quite a few of the presentations that we've done with OHTs is that we need to recognize that this is difficult in certain areas of the North, in that we must rely on interpretation services. So this is something that we will be adding in this slide. And if there's anything at all that you see that, oh my God, we need to tweak this needs to be changed, let us know. This is the goal of this. So this key indicator is the percentage of Francophone clients referred to a partner or received interpretation services. And the last one, when we talk about it, is number 6. This is the measures. Now, these indicators that are noted are not new indicators. These are indicators that are all part of your reporting, your FLS annual reporting that you do. So the information, we're not asking you to add on, additional indicators of what you're, over and above of what you're already collecting for your FLS report. So a lot of this information is already there. It's not additional work, but the way that we will be able to do it is gather that information per HSP for yourself. You see where things are going, or things are moving along, and at OHT levels, because OHT also have the responsibility to provide information on their equity plan. So this information can be used for that purpose. And it can also be used for your purpose, for your equity plan, as Fanny mentioned. The other important piece is you have 6 actions. You do not need to register or implement all 6 actions at once. You can choose to move forward at your pace, at what you feel as an organization you're able to do. That we recognize, and we support you in being able to do that. However, saying that, we do encourage you to, at least at minimum, have a contact person and start looking at number 2, which is the implementation of looking at registering for the active offer training. This training offers, it's a 3-hour training, it's online, you can do it at your own pace, and there are also complementary modules, which are about 45 minutes to an hour, which are very specific for primary care, mental health and substance abuse, and long-term care. Am I missing one? I think that's what we have so far. We're working on that, on others though. That's the thing. I think there's one that, so we're working on others at this point in time. So that's the options that you have for you on the table, and the importance of working with the RESO and OH North also in regards to where do you want to go with this. And I think that's all that I wanted to just highlight in regards to what it means and why we're doing this. It's just easier to gather the measures. And then we have measures for the North, measures for the East. We're also looking at creating a committee, not a committee, but a group where you would be able to share your best practice. Are we doing this as just the North, just the East, or can we also share our best practices between both the East and the North as to where things are going and how we're moving this along? And I see there's some questions in the chat. I've been talking, so I haven't been checking on this. Palandri, I recognize this champion. Is this an additional workload? It shouldn't be. We're looking at someone in the organization that probably already carries that responsibility, either completing the report, the FLS report, or working already with us in regards to the, who will be working with us in regards to being able to, a contact person for the, active offer training. So it's not additional work, it's more of a sharing of the information. So we're not asking somebody to have this at the corner of their desk and it's an additional a day or a work a week. No, not at all.
Can I clarify my question?
Oh, sure, Palandri.
One of the things is, in order to sell this to the staff when we're working with patients, residents, or clients, is that they can, it's helping them to understand that they will not be adding work to their workload, but on the contrary, helping them to figure out their workload in order for them to be fair. Because one of the things when we're seeing at the hospital, for example, is the staff refuse to identify themselves providing French services because they say, I'm going to have a greater workload. So I think it's important that we can sell it appropriately by indicating clearly when recruiting champions or resource person, here what the expectation here are, and we will not be adding your workload. Because if they perceive it has been adding to the workload, they will refuse to collaborate.
Totally agree. Thank you for that. And it's also part of the next steps. So today it's basically a very brief overview, but thank you for that clarification. Oui, c'est très important. And the other question too, there's a service provided by volunteers. So yes, they can definitely be included in this. That's anybody that is part of your organization, volunteers or other, can take part in this. It doesn't have to be just the staff. That's up to you as a health service provider to decide how you want to roll this out.
Okay, thank you for that. So as part of that question too, is that going to be the expectation? Because when we're looking at doing FLS stats and providing information in regards to the number of clients that were serviced in their mother tongue or in French language, oftentimes at the Canadian Red Cross, our services are provided through volunteers. So is it recommended for those HSPs to definitely include volunteers in this focus as well?
I think that's a good point that you bring up. And certainly I would say at my end, it certainly would be, but it's definitely a discussion that we can also have as a fuller, as a group to see how best that we can reach those people.
Okay, thank you.
But I totally agree. Yeah, that makes a lot of sense. And France, you had a good question here too in regards to the need to differentiate between the percentage of clients seeking services in French and those who identify mother tongue as French and be more comfortable receiving their services in English. And I think that's a good point that you bring up. And a lot of us have this insecurity of being fearful of not being able to understand if we receive our services in French, or we will be waiting longer, or we're not going to receive the same quality of service. And the goal of this whole exercise is to offer that security to the client that, you know, even though you request your services in French, you're not going to get a lesser service. But yes, if it's something that you feel that would be important, I have no issue with that. But it's also important to try to see if we can change that, increase that number of percentage of clients that are receiving their services in French. Often they say no because they're just fearful. I'm not going to understand. They won't understand me. I don't know where I'm going. This doesn't make sense, or I don't understand. A lot of our generation, the older generation, went to high school in English and have a difficulty understanding reading in French. My parents were part of that. I was kind of in the between, where my books were all in English, but I received my education in French. So a lot of us feel more comfortable reading in English than actually, but we can speak French. So we need to take that into consideration. So that would be interesting that we can have that discussion and see what we can do with that.
Yeah, that was the exact nature of my question, because the reality is, and I'm completely on board with, of course, we want to be able to offer with the mother tongue, but there, I mean, my parents' generation is exactly the same, and I'm also in that. And so I definitely see the value in seeing if we can track that trend over time and seeing if we are narrowing that gap, you know. So that's why I was thinking it might be an indicator that would be good to track.
Merci pour ça. Yes, thank you. That's a great point. And then, yes, there's another question. Will we be receiving the slides? Yes, of course, you'll be receiving the slide and the recording. You'll get a link. And we'll also make sure that if there's any, we do have some more Q&As that we can share with you that we'll be preparing. So for sure, you'll be receiving all that. And we will also be meeting as a team very shortly to go over the next steps. So you will be receiving an email just basically looking, you know, I think for now, the most important thing is to look at who in your organization could be a point of contact. And we're not asking this person for an additional workload. It's basically to share the information How can we go about to start moving forward with the active offer training? So, and then a lot of the other information will come from your reports, but we will be keeping in touch with you because there's important questions that have been asked today, points that need to be discussed further, and we certainly want everybody's input as to how we will be doing this and how our communities of practice that I mentioned earlier. If there's an interest, we can certainly start creating those in terms of sharing the best practices. How do we want to share our indicators in terms of the data that we've been collected, and do we share it? You know, we have a lot of OHTs that are participating in the East and the North. It would be nice also to demonstrate to the province how we're moving forward. I don't know if there's anything else that
Paul-André a la main levée, Monique.
I can't see any hands, so I see there's
Paul-André.
another. Vas-y, Paul-André.
Merci. It's interesting that we're talking about the literacy because my colleague and I, Isabelle Carignan, we did also some work with the open heart surgery. So we developed 4 videos and help people to understand how people go through when they go for heart surgery. And we did also some work with the French community to identify how comfortable they were receiving the service in French. And we have the video also available in English. So then we kind of studied them, and we have a presentation that we do now and talk about the expectation and how comfortable people feel about these things. Because one of the concerns we had was people who may had schooling in French when they were younger may not fully understand the words. So when we prepared the videos, we took that into consideration. And some of the words that appears in the information are appearing in both languages for the French version, and also that the presentation, the speaker goes slowly in order for the people to have time to read and also to understand. If they are really uncomfortable, so they can switch to the English video, who's the same thing, except we got a colleague who's an English-speaking nurse who pronounced the word in English without an accent. So that can be an interesting presentation that we can do if you need more information about that.
Merci pour ça, Paul-André. Didier, you had a question about follow-up sessions also available in French. If there's a need, s'il y a un besoin, définitivement. We need to work very closely with Sabri. That's the 6th OHT that has yet to come on board with this. Mais oui, si les gens désirent des sessions en français, on peut absolument en offrir, c'est aucun problème. Est-ce que ça répond à ta question, Didier? Is there anything else?
No, that's good. Thank you.
Okay. Can we stop the share slide? That would be awesome. And thank you, Leslie, for sharing that. Terrific to hear OHTs would be able to exchange. I think that's, and there's already just a community of practice. There's a existing OHT shared space, which we could leverage. That would be great, so that if we can start working there, that would also be something that we can certainly consider. Thank you for that. I think I've covered all the questions. If there's anything else, please let me know. Because I can't see all the hands, so. Awesome.
I think if we have an update also in a few months to see how things are going, will be helping us also to answer the specific question about implementations, if there's some challenges.
For sure, and that's something that we definitely want to work at the OHT level, and that's why we sought the support of the OHTs to be able to move this forward, so that we would be able to, it would be easier for us to provide that information at OHT level and have those discussions there. If there's an expected timeline for implementation, no. We are starting the rollout, and the rollout will happen as HSPs come on board, if they're comfortable, if there's any questions. We don't expect everyone to come on board all at once. That would mean that for us, we would be overwhelmed. but we would definitely be working with you as to where your needs are and when you are ready to come on board. That would be great. So in the course of the next few years, I think in the next year, in the following year, I think we would be able to provide some reasonable updates as to where things are at.
Monique, just to be
Oui.
clear, if everyone does onboard at the same time, we will make it work. So don't let that be a deterrent. Okay, come on, join us. Don't want to deter you. We will handle it.
Yeah, but we're not pushing you to have to do this by the end of December. No, in that sense, no, not at all. And I know as some OHTs are busy, do have a lot of work, but a few of them have started FLS committees, which the role of the committee is actually to work on this initiative. So that's going to be very helpful for some OHTs, and we could certainly share how it's going. And we will be providing you regular updates as to where things are at, for sure. That is something that we will be doing.
If I may add, one of the things we're finding is when people are satisfied with the services they receive also in French, there's less complaint, official complaint and non-official complaint, and less complaint on social media. So I think it's an advantage for institutions to try to see how we can work it out together.
For sure. Merci pour ça, Paul-André. I'm not seeing any further questions. I don't want to keep you longer. You have taken, given us your lunch hour to be able to do this with us. So I don't know, Diane, do you have any closing remarks for us, or I'm putting her on the spot here?
Anyone prepared anything for me? No, I'm joking.
No, I didn't.
Anyways, again, thank you very much, everyone, for coming today, for being part of the initiative, for supporting the initiative. As Monique mentioned, 5 OHTs have already supported the initiative, and we appreciate that. Thank you as well to Ontario Health and for their ongoing support. I think it's in the interest of all our communities to be better able to serve the Francophone community, because healthy population is what we're all aiming for. So thank you again for being here. Thank you for your time. And we look forward to continuing to work with you on this new initiative.